Today, let's code Mohs in 6 easy steps. Now remember to like, share, and comment on this video if you find this information helpful. Your participation in the content really does help motivate me to create more content for you. When reporting Mohs surgery for treatment of skin cancer, documentation must confirm that a single provider acted as both the surgeon and pathologist. From there, you need only know the location of the treated lesion, plus the number of stages and required tissue blocks to select an appropriate code. Step 1. Confirm the surgeon and pathologist are the same. Mohs requires that a single physician act as both surgeon excising tissue and pathologist, immediately examining excised tissue to determine clear margins. Per CPT, if either of these responsibilities is delegated to another physician or qualified healthcare professional who reports the services separately, the Mohs codes should not be reported. Step 2. Identify location. CPT categorizes Mohs procedures by location for lesions of the head, neck, hands, feet, and genitalia, or any location with surgery directly involving muscle, cartilage, bone, tendon, major nerves, or vessels. Look to code 117311 and add-on code 17312. For lesions of the trunk, arms, and legs, select code 17C0313 and add-on code 17C0314. Regardless of location, you might also need to report add-on code 17C315. Step 3. How many stages? How many blocks? Things become more complicated at this step. It helps greatly if you understand what the surgeon-pathologist does in the procedure room to spare as much healthy tissue as possible while still eradicating cancerous cells. The physician removes tissue in stages. The first stage is to excise the lesion. The specimen is divided into smaller portions called blocks. Per CPT, a tissue block is defined as an individual tissue piece embedded in a mounting medium for sectioning. The location of each block within the stage is carefully mapped, and each block is examined for cancer cells. Where the surgeon sees a clear margin, no malignant tissue, no further excision is necessary beyond that block. Where the physician finds malignancy, a further stage is required to remove additional material. This is the second stage, which is again divided into blocks. The process continues until no further cancer cells are identified. Bottom line, each time the surgeon excises material counts as a stage. Each slide resulting from an individual stage counts as a block. Step 4. Separately consider each lesion treated if the surgeon-pathologist uses the Mohs technique on multiple lesions during the same session. Code for each lesion separately. Step 5. Put it all together using steps 1 to 4. Test your skills with this coding scenario. Let's try a case together. Get out your CPT book and turn to the Mohs codes. The patient presents with a basal cell carcinoma of the central portion of the forehead. After prepping the patient and site, the physician removes the carcinoma, first stage, and divides it into 4 tissue blocks for examination. Upon microscopic examination, the physician finds the margins are clear of carcinoma. What are the appropriate codes for this example? The appropriate coding would be CPT 17311. Let's do another example together. The patient presents with a squamous cell carcinoma of the nose. After prepping the patient in site, the physician removes the carcinoma first stage and divides the stages into 6 tissue blocks for examination. Upon microscopic examination, the physician finds their positive margins. He removes the positive margin with another excision second stage, which is divided into 3 tissue blocks for examination. Upon microscopic examination, the physician finds the margins are negative. What are the appropriate codes for this example? The appropriate coding would be CPT 17311 first stage, including plus 17,312 second stage, and plus 17,315 6 blocks. Would you like to try another case? This one is more difficult. Be sure to stick it out to the end of this video to get the correct answer, and make sure to move these examples to your CPT book. You never know. One of these examples may be on your medical coding certification exam. Let's try this advanced case together. The patient presents with 3 skin cancers, basal cell carcinoma of the right neck, squamous cell carcinoma of the right hand, and squamous cell carcinoma of the left ala. After prepping the patient and the sites, the physician first removes the BCC of the neck. He divides it into 2 tissue blocks. Under microscopic examination, the margins are negative. Next, the physician removes the SCC of the hand, dividing that stage into 3 tissue blocks. Under microscopic examination, the margins are negative. Lastly, the physician removes the SCC of the left ALA, dividing the stage into 6 blocks. Under microscopic examination, there is a positive margin. The physician then takes a second stage, which is divided into 2 blocks. Under microscopic examination, the margins are negative. What are the appropriate codes for this example? Did you catch an anatomy term you need to know in order to code this one? Where is Allah? Hint nose. The appropriate coding in this scenario is CPT 17,311 neck and 17,311 with modifier 59 distinct procedural service hand and 17,311 with modifier 59 nose and 17,312 second stage of nose, including 17,315 extra first stage of nose. One more step in this process is step 6. Be on the lookout for separate procedures the physician may need to conduct additional procedures during the same encounter as a Mohs procedure. Depending on the procedure and the circumstances, you may be able to separately report additional work, biopsy, and histopathologic exam. Because histopathologic examination is included in the Mohs procedure, you may not separately report pathology codes 88,302 to 88,309. Likewise, you would not typically report biopsy separately with a Mohs procedure. The exception to this rule occurs when there is no prior pathology confirmation of a diagnosis according to CPT. In such a case, the same-day biopsy. If the patient comes in and is not scheduled for a Mohs today, but after seeing the MD for today's visit, a Mohs surgery is done same day for the patient. For our last example, a new or established patient is seen in clinic for a routine skin check. During the examination, the provider identifies a suspicious lesion of the left cheek. After discussion with the patient on treatment options, the patient consents to a biopsy of the lesion. The area is prepped and draped in a sterile fashion with the use of a 3 mm punch tool. The provider takes a biopsy of the lesion. The specimen is then prepared for frozen section and is found to be positive for BCC. With the patient's permission, the physician performs a single-stage Mohs in removing the carcinoma. In this example, what would be the proper reporting codes? In this example, the proper reporting would be CPT 17,311 for the Mohs surgery of the cheek and 11,100 with modifier 59 for the biopsy, including CPT code 88331 code with modifier 59 for the frozen section of the biopsy. Be sure to save this video to review multiple times. Be sure to head over to medicalcodingbyjen.com for more resources, including free practice question area, free book prep videos, and shared free photo gallery. I hope that you have helped me out by engaging in this content by liking, sharing, and commenting what else you would like me to go over in our next lesson.